If a new or existing patient also has an additional health complaint which you wish to track and monitor, then you should assign them on the additional health complaint pathway. Find the patient and click Create a new pathway for this patient. Or, in the patient's clinical record, click No Other Pathways under their name, and then click Add a New Pathway. Under Pathway, select ACU-Track Additional Health Complaint Pathway. Then click the Add and Open Pathway button.
If they are a pediatric patient, make sure you assign them on the Pediatric Additional Health Complaint pathway.
You will now be able to see the additional health complaint pathway in the patient's clinical record. When you open this, you will see a new form in red, Patient's Additional Health Complaint, which is the form that will categorize the patient's additional health complaint for this pathway. ACU-Track lets you monitor this complaint in two different ways. 1. Without initiating a new plan. This option allows you to quickly and easily monitor an additional health complaint without initiating a patient on a new plan. Simply have the patient complete the Patient's Additional Health Complaint form. This form will have been sent to the patient automatically by email when the pathway was created, so they can complete it remotely, or you can load the patient portal and complete the form in clinic. Once completed, you will see the form appear in black under Health Complaint in the clinical record. This will also have triggered a series of patient's health complaint follow-up forms in gray under Future Tasks, which will be sent to patients in the future at predefined time points. Just like with a patient's main health complaint, this simple form contains a retrospective question asking the patient how their health complaint has progressed, as well as an additional question asking if there are any other factors which may have affected this health complaint. Two, initiating a new plan. Alternatively, you can initiate a patient on a new plan if you would also like to use another outcome questionnaire to monitor their additional health complaint. Initiate the plan which you feel is most appropriate for monitoring the patient's additional health complaint. This process is exactly the same as for the main health complaint.
If you choose to initiate the patient on a new plan, do not initiate the patient on the same plan twice for two different health complaints. This ensures you avoid sending duplicate questionnaires to the patient, for which their answers will be the same. The exception to this is the pain plan. This is because the pain plan can be health complaint specific, as pain levels can be different for different health problems. Therefore, their answers are likely to be different.
Please note, whilst you can assign a patient on more than one additional health complaint pathways, we recommend that you do not assign a single patient on more than two pathways at the same time. Otherwise, this will risk overburdening them with questionnaires and forms to complete and may confuse them as to which health complaint they are answering about.